Well, I hope everybody's awake from their great grits and shrimp and ready to push on here. I want to thank you for the opportunity to talk with you about some of the work that we've been doing related to using incentives to get lower income households to buy fruits and vegetables. I think the overall goal for us and for those of us working with incentives to change food purchasing behavior is really try to improve population health through lots of different kinds of strategies that encourage consumption of healthier foods and also make it possible for lower income households to be able to buy them. The research and policy questions are really, who do these incentives work for? Who do they not work for? What are the forms, the best forms to use them in? We've just heard about moving to EBT, and I'll be talking about that a little bit. For what purpose? For how long? And what are some of the cost issues related to it? The study that I've been asked to talk about is, we refer to it as the reward study, and it was designed to test the impact of a consumer rewards intervention on increasing purchases of fresh and frozen fruits and vegetables in lower income families in Philadelphia. Our primary outcomes were the number of servings of fresh and frozen fruit and fresh and frozen vegetables purchased per week. The design of the study was twofold. We did a randomized controlled trial with wait-listed controls, meaning that the control group eventually entered into the intervention but had a delayed baseline period. And then we also did a longitudinal cohort study to be able to use all the data from all the families. So we had a baseline period that was 8 weeks that consisted of retrospective shopping data as well as extended prospective shopping data from those in the waitlisted controls. We had an intervention phase that I'll talk about in a minute that was 8 weeks. Then we did a tapering of the intervention that was 4 weeks. And then we had a follow-up phase that had no incentive that was 6 weeks. We conducted the study at one full-service supermarket in Philadelphia that was established as part of the Pennsylvania Fresh Financing initiative to increase the number of supermarkets in low-income households. And this was done between 2010 and 2011. So our intervention, we used a delayed incentive based on accumulated purchases, meaning we provided it after a while rather than right at the moment. The way that it worked was we provided dollars that were added onto a supermarket gift card that was based on the participants' purchases. During the intervention phase, we gave 50% of the dollar amount that was spent during the intervention to the participant, and that amount was reduced to 25% during the tapering period, and then eliminated at follow-up. We also had tailored reports that we sent to the household shopper about their purchases during the intervention and tapering period separately that had personal notes and I'll show you an example in a minute, and specific study newsletters that talked about the basics, buying fresh fruit and vegetables, how to prepare, how to store, pretty standard newsletters. We had tried to do immediate feedback at the point of sale, but because of technical problems with the supermarket, and this was not a big budgeted study, we're not able to do the direct point of sale. We wanted to have feedback right on the receipt, but that wasn't able to be carried through. So the methodology that my group uses collects objective supermarket data using the loyalty card. So what this shows here is the participant buys, goes to the checkout, swipes the loyalty card. The data from the store are sent to my staff, and we have prepared reference files with all the items in the store. We link the loyalty card purchases to the reference file, and that gives us, in the case of the reward study, the number of points that the participant would get during the intervention or tapering phase. And that's a methodology that we've been using for the past 5 years. So in the reward study households, I said it's not a big budgeted study. We had 58 households. And you'll see here that the average age is high, and that's because we had a lot of grandparents who were the primary shoppers, even though there were children living in the household. And the majority of the households earned $25,000 or less. 62% were enrolled in SNAP at the time of this study, and 29 in WIC. Now, before I go into the results on that study, I'm going to diverge a bit and tell you that the study was based on pilot work that we did. And this was a coupon study. Also involved lower income female shoppers, very similar to the profile that I showed you from the reward study. This focused only on fresh produce. And we had 4-week phases, a baseline, an intervention, and a follow-up. In this study, participants got 4 coupons for $10 off the purchase of fresh produce. Each coupon was good for a one-time purchase for 1 week during the 4-week intervention. Each coupon was a different color and numbered, and very clearly linked with the calendar that we sent them, that showed the colors of the coupon with the colors of the weeks. They also got 1 healthy newsletter, and everything was assessed to be at or below the 6th grade reading level. So the coupon that we used is shown in the top right-hand corner here. This figure from the baseline shows the average weekly expenditures of fresh fruits and vegetables before we had used the coupon. And as you'll see here, the majority, the y-axis is the number of households, the x is the average weekly household spending on fresh fruits and vegetables. And as you can see, the majority of the households spent less than $2 a week on fresh fruits and vegetables. So after we moved folks into the intervention and follow-up phase and analyzed the results, we found that the average weekly purchases of fresh fruit increased by 4.7 servings from the baseline to the intervention. And the average weekly purchases of fresh vegetables increased by 1.8. When the coupons ended, we found that households still bought more fresh fruit than they did in baseline and bought similar amounts of vegetables. So this was a short, kind of quick and dirty intervention. I don't mean dirty intervention, but it was a short, a short study. We had a quick uptake in the fruit area because it's easier to get people to buy fruit. But this was just a pilot. This was what we based our work on and learned from it. We've heard talk about the redemption issues, and the redemption in this pilot was very low, so we thought it was low. 38% used 2 or more, and there were only 4. 28% used 1, and 34% didn't use any. The issue for us with the coupons, aside from the problems with the redemption, was that we had already paid for them and paid the store, so we lost money on that, and the participants were not able to benefit from it either. we did some feedback at the end of the study, and participants said, as we've heard earlier, it was hard for them to keep track of the coupons. They forgot to bring them with them. They lost them. The store personnel wasn't familiar enough with it. So we had kind of a mixed, somewhat disappointing feeling that the coupons were not really the way that we wanted to proceed. So what we changed, first off, I didn't go into this in the early part, we verified the shopping history in the store to get people who actually shopped a lot at the store, and that's more of a research issue. We added a tapering phase so that we might increase the likelihood of maintaining the change once the intervention was stopped. And we decided to use a delayed rewards rather than an immediate voucher to get people to build points with the idea that that might also be good for sustaining change. We increased contact with the participants, and we thought we simplified the method so that all the shopper had to do was bring the gift card on the next trip. When they checked out, it would go right off their bill. This is an example of the communication that we had with the participants for the reward study, and that shows you can see here the number of reward points, how much you've earned, and some encouragement to keep purchasing. So this figure shows the progression of the study over time. You can see the top is the vegetables and the bottom is the fruit. And it's pretty apparent from the graphs that the intervention purchases are up from the baseline. And it's pretty apparent from the graph that the tapering drops. So this is when we went from 50% to 25%, and then the follow-up just sort of fades out into the distance. So the decrease of the incentive and the decrease in the purchase seem to be shown in these graphs. When we analyzed both the randomized control data and the longitudinal data, we found that households in the intervention phase purchased an average of 8 more servings of vegetables and 2.5 more servings of fruit per week than did controls. So those are pretty strong results. Then when we looked longitudinally, when the incentive was reduced, as you saw in the graph, both the 25 and 0, both the fruit and vegetables were similar to baseline. In other words, wiped out our results from the longitudinal. So in the short period I've got left, we did find with the rewards participants that there was low research burden and that people were positive about being able to buy different kinds of fruit and vegetables that they hadn't been able to buy with without the incentive. And the challenge is similar. We've already heard pretty much what those kind of challenges are for any low-income household. So here, I just laid out our 2 studies plus the study that Dr. Stallings referenced that I have also found very interesting. Looking at the program, the targeted foods, the incentives, and additional components, and the redemption issues. And I think what you can see here is that no matter what we're doing, we need to increase usage, and we need to think about sustainability, because obviously without those incentives, we're not able to sustain the uptake at the moment. And just some parting thoughts. I think that incentives can be very useful to jumpstart purchases for some people. I think it's obvious that it doesn't work for everybody, and we have to figure out those people who are not engaged, are there better ways to engage participants so that we can increase usage? And the ease of implementation, we've heard this discussed earlier, and mechanisms for implementation are clearly important. And it is hard to reach the hard to reach. So, thank you.
Any clarifying questions for Tina? Thank you so much for your talk. Stan Bine is next.